It is National Immunization Awareness Month, a time to highlight the importance of vaccinations. So joining us to talk more about it is Dr. Greg Buller. He's the chair of medicine at Bridgeport Hospital. Doctor, thanks so much for being with us. Welcome to the show.
Oh, thanks for having me. I appreciate it.
All right, it's important for people of all ages to stay up to date on their vaccinations. What are some things that people sort of forget about? Why is it so important? They need a reminder, right?
Right. Well, there are a number of infectious diseases that are just, fortunately, mostly behind us, although measles has made kind of a bit of a recurrence. But fortunately, we live in an era where, if as long as we get vaccines, we're not concerned about these various diseases, but they took a huge toll back before vaccines were developed.
And now is really the time that parents need to start thinking about it, because those medical forms, those physicals, they need to be done before the new school year starts. And what are some things people need to keep in mind as far as things that may have changed over just 1 year?
Well, always, as you kind of imply, children need to get their vaccines done before they start at school. I mean, that's key. Now, the exceptions to that are, of course, the flu and COVID vaccines. I mean, those, as a friend of mine, Karen, who works in the West Haven school system, says, when the leaves change, you get your flu shot. And as long as you keep that in mind, that's the perfect timing for flu vaccine. But all the other vaccines should be done before your kids enter school.
And what about us adults? What are some immunizations that we should be looking to get or putting on our calendar to make sure we get those as well?
Yeah, still at the top is, COVID vaccines. But along with that, influenza. Even though COVID seems to have gone into the background, over the previous year, there were 70-some thousand deaths due to COVID, or about 44,000 due to influenza. Just reinforces those deaths are largely preventable with vaccination. There's a new COVID vaccine that will be out. There will be 3 different subtypes. It targets the new variants of COVID. That'll be out in the fall, along with the flu vaccine. If you've had a COVID vaccine in the last, 6 months, I would advise waiting unless you have gone more than 6 months without a vaccine, especially if you plan to travel like by air or something like that. Then it's wise to just go ahead and get a COVID booster.
And talk to those who maybe have not gotten the booster in the last year or so.
I'd encourage them if they have, any kind of immunodeficiency. If they're going to travel, they really should go ahead and get a booster now. It's probably not a good idea to wait. There's going to be maybe a modest improvement in the amount of immunity to the upcoming COVID variants with the new vaccine, but to be honest, it'll probably be relatively modest. It's more important to have the vaccine, which covers really virtually all COVID variants that we're exposed to at the present time.
And you did mention traveling. Now, it might be a little bit late in the season for folks who are going to be, but just talk about some of the reminders, some things that people need to keep in mind for the future for traveling that they should be getting done if they're going to be leaving the country.
Yeah, well, again, I can reemphasize the wearing of masks. A lot of times one worries about being on an airplane. Airplanes, though, recirculate air very, very frequently. It's probably more important to have a mask on when you're in the airport, around a lot of people sitting, waiting for an airplane, et cetera. If you're on a train, they don't recirculate air nearly as much as airplanes do, and it's probably a good idea to wear a mask there. And this is especially important if you're not up to date with your vaccines, or if you have a problem with your immune system.
All right, Dr. Buller, thanks so much. Really important reminders. We do appreciate your time.
Absolutely. Thanks a lot for having me.
And you